okay, we have our diagnosis. We know let's imagine it's my knee. We know there's something going on here with my knee. I can't run at the moment. I can't squat at the moment. Is that it? Like, is there anything I can do, as part of this diagnosis level on our rehabilitation framework? Are we looking at anything else? Are we, the idea of let's not detrain, let's not decondition at the same time?
Well, Mike, you said it there, is there anything I can do?
Yeah.
And that's something that I think is exactly the way I would frame it. Let's find out what we can do, not what we can't do here in this early phase. Well, yes, we have to protect the injured tissue. There's loads we can do. We can start by priming your recovery, by giving you advice around the importance of sleep, the importance of nutrition, the importance of stress management. We can also start to exercise the non-injured areas. Begin by loading those muscle groups. So if you have a lower limb injury, can we load the other limb, and can we load your upper body? Can we also get you started on an aerobic program to start working on your conditioning? And I think there's a huge part there, which it can be a big mindset shift, because so often what happens is, I get injured and the rug gets pulled from underneath me, and I now can't do the things I enjoy. And it can have a real effect on our mood and our sort of sense of self as well, a little bit, where, I can't do the things that I identify with. And it's I think a huge part of it is kind of helping people gain control over that again and get back doing things that, we start feel like we're moving in the right direction. And of course, aerobic training helps my recovery. Certainly it's important for my overall health, and it's usually important if I'm involved in any sport that we start building a base there. So what we don't want is that our injury is this kind of, reason why everything falls off the wagon. We want to be much more proactive than that if we can. As I said, oftentimes, like, framing it early as our goal here is to come back better than we ever were. So we need to start that now. What are the things we can work on? What are the things we can improve? And I think that's a really powerful framing, and people often leave, I think, energized by that idea when we've mapped that out. And it is important to spend time on that early on.
Yeah, it's that idea of, can I make plan B as close to plan A as possible? And like, we've both been there, right? We've both played sport our whole life. You get injured when you're fit, you're giving out about training on a wet, cold, night in November, and you're saying, oh geez, I'd love to be staying at home right now, cozy at home. And the second you're injured and you can't do it, that's where you want to be. So, it's a huge part of the athletes come into us, or, even the older person playing a bit of golf or going for their walk with their friends. It's a huge part of your life. And, when you can't do it, as you said, the mood can drop a bit. So having this really sort of global, all-encompassing plan of, okay, let's not do this, this and this, but let's definitely do all of this, I think can really help the athlete. And, I'm huge on the sort of the science behind this detraining and this deconditioning. And if I'm an athlete and I've spent 15 years building my aerobic base, and the second something's injured, I just do nothing, well, I'm going to start to detrain, at a reasonable rate. Or if it's strength and power training, if my knee's at me and I just say, well, I'm not going to the gym if I can't do everything, I'm going to lose that muscle mass, that power, that strength, again, quicker than I'd like. So, let's lose as little as possible. So if I drop a little bit and, we fix the problem knee, I'm coming up from an okay base. Whereas if I let that fall off a cliff, I've a bigger stairs to climb.
Yeah, 100%. And, it's simply like, don't stop. We don't want to stop our activity levels. We don't want to stop training. We want to change our training, adapt our training to suit our needs right now. And that's what we can help people with as physios, but we don't stop. And that's a really important thing. And I think that can be a mindset shift for people, which is really important. Hugely important part of the sort of diagnosis phase is pain management. And, it's one of the most important things for clients and for us too, is that we help people get on top of pain. What works for you, Mike?
It can depend on what the injury is, what the diagnosis is. So, the old sort of RICE, or now it's the police protocol. Do we need to protect this site? If I've rolled my ankle or I might have had a fracture, do I need to offload it? Do I need to tape it? Do I need to mind it? Do I need to go into a sling for my shoulder? Is there a lot of swelling? Does it need ice, or is it well left alone? Do I need anti-inflammatories? Do I need painkillers? Do I need to sort of offload or protect? That can help. Sometimes actually by doing our initiation, which we'll get to now in a minute, but sometimes by starting my exercises, that can really help for my pain. If this long-standing knee pain when I walk down the stairs and my knee goes forward is difficult, and my quad is really weak, and sometimes I give someone a quad exercise or a knee exercise and they feel really good after, I say, well, actually, that's your painkiller. This exercise is your painkiller. You're going to feel better after you doing this, more so than after taking your anti-inflammatories. But we're trying to get to, I suppose, what kind of pain is this person coming in with? Is this a bog standard muscular pain? Is this a tendon pain? Is this a bone pain? Is this some sort of neuropathic pain? Or is this, something way more complex, a more centralized pain, or a complex kind of pain presentation. So, it's part of our accurate diagnosis is to figure out, is there a structure involved here? Is there a particular type of pain involved here? Have I seen this in the past and I know I can help them, be it with modalities, be it with ice, be it with electrotherapy, be it with medication, be it with exercise. How can I get that person feeling better? And if you can get that person feeling better, within that first session or ASAP, they're going to really trust you and they're going to hopefully follow the plan from here on out to get back to where they want to go.
Yeah, no, spot on. And I think it's such an important area. And I think, the kind of the management of pain in kind of the physio world has progressed quite a bit. You mentioned we have our RICE protocol. And I think a lot of people are still stuck on the RICE protocol. You still hear it mentioned a lot. And then you have your police protocol. And, even more recently, you have your peace and love protocol. And it's just been really interesting to see how that actually develops over time. And
I think they developed that in Woodstock.
Yeah, I like the name of it. But I think, there's so many areas to this. And I think in the clinic here, a huge part of what we do, I suppose, around pain management is advising people, first of all, advising people to maybe avoid things that aggravate them, try and help them identify the things that aggravate their pain, whether that's an activity or maybe a total amount of load or, how frequently they're doing things, and to open up the door to ways to create the conditions for them to feel less pain, which often is focusing on things like recovery, optimizing sleep, getting their nutrition right, managing stress, and just taking some relative rest away from, stressors that may be activity related or it could be more life related. And alongside that, it's exercising the body in a way that is therapeutic. So it's showing someone exercises and movement that helps their pain. And again, that can be very simple, and sometimes it's a little bit more in depth and complex. And that our skills there around exercise selection are really, really important. And why does exercise help? Well, I suppose we get increase in blood flow. We get warming up of that tissue. We often get we get pain inhibition often, and when we exercise, we can fire those muscles up a little bit better. They become less inhibited and then start to function a bit better, which can often make the joints that the muscles surround feel a lot better. And we also get a greater sense of, self-efficacy. I can actually do this, and maybe I've been avoiding this for a long time. And our bodies are built to move. We're healthiest and happiest when we're mobile, when we're active. So if we are inactive, while we can sometimes be using that as a coping strategy to reduce pain, ultimately getting you back active and moving is really important for reducing your levels of pain and restoring your function. So I think they're all really important. And then our skill set as manual therapists can come in here a lot, whereby we can facilitate people moving better and feeling better with some hands-on therapy. That can be some soft tissue work, sometimes some joint mobilizations. So this can include, massage work or mobilizing a joint. And I really like to combine this with exercise so that we use the soft tissue based work to facilitate giving someone exercise that also makes them feel better. Because I think it's always about empowering people to be able to make themselves better rather than having it too much so that they need someone else to make them feel better.
Yeah.
I think that's really important.
And I think though, we almost need to check ourselves on this pain side of things, that this can be really, really scary for the person in front of you. And, while we might have seen 1,000 shoulders and 1,000 knees, this person's coming in, they're not booking into us for a laugh. They're booking into us because this sore knee is actually really affecting their life. And maybe they're really, really worried about this, and they might have seen a couple of people before us, and they have a neighbor who had a bad knee and couldn't play golf anymore. And now, maybe their own sense of community or sense of, I suppose, normal everyday activity is being affected here. So this can be scary. It can be worrying. They're not booking into us. And again, for our diagnosis might be weak rotator cuff and asymmetrical loading during certain exercises, but they're not coming in saying that. They're not saying, Richard, I think I have a weak rotator cuff and asymmetrical loading. They're saying that I've pain in my shoulder, and pain is the main driver. Pain and injury are the drivers of people booking in, and we don't want to gloss over that and ignore that and just jump straight into this. What you need to do, it's actually explain the pain, explain why it's there, show them this movement's sore, this one isn't, or that one isn't.
Yeah.
We'll get to that initiation phase in a minute, but, hopefully if we can initiate the right exercise or the right protocol or the right pain management and they feel better, that's relief. That's fear dying down. That's maybe I will get back playing tennis with my friends and go for a coffee afterwards because I'm really meaning that, I'm really missing that. or maybe that is I can get back on the pitch and play GAA or rugby or soccer or whatever it is, that's my group and I've been training for years and the big final's coming up. So yeah, we can't gloss over that pain side, because that's often the biggest thing that they come in saying to us.
Absolutely. And I think an important thing to always try and help people with is, first of all, just empathize with them and to listen to them and to validate the feeling around pain that they have, and to acknowledge the stress that can come with that, and the impact that can have on someone's quality of life, as well as their identity and their ability to do what they want to do. I think that's really important, absolutely. And I think, there's probably, different ways in which we deal with pain, and maybe different types of pain that are really, really important, as you touched on all the different types of pain. And one of the important areas, I think, for us is trying to help people understand what their pain means. Does this pain mean that you need to stop? Does this pain mean that that every time you do this thing, you're damaging yourself? And quite often, pain doesn't mean I need to stop, and it doesn't mean that pain does not equal damage. They don't mean the same thing, but there of course can be a relationship, and is a relationship between pain and injury, but they are not one and the same. So sometimes we have pain that is trying to protect us, and it is guiding us maybe to become less active and to change our behavior. And part of us is to try and work with that pain to help people try and find a way forward and find a way to improve, and of course reduce that pain and improve it. And depending on the length that the pain has been there, etc., there can be a very different meaning behind the pain. And it's a detailed area that we will often spend a huge amount of time with our clients. And I think one of the things we have expertise in is dealing with those maybe more complex pain scenarios. And it's probably for another chat to go into the details of it, but it's certainly an area that is it's really important, I think, for people in persistent or chronic pain, that they're listened to and that they're heard, and that they have a support there from therapists that can help them. And certainly something that we enjoy working with, and that we can often see big progress with.
So, Richard, we have our diagnosis. What next?
So next we go into our initiation phase, and this is where we look to sort of isolate the injured tissues and begin to load them. In some cases, it may be involved. There's a longer rest period, for example, if we have a fracture. But if we're talking about muscle injuries, and I suppose most musculoskeletal injuries, we're starting to exercise early, and we know that getting involved in loading the body at the appropriate level, loading the injured tissue at the appropriate level, is massively important for restoring function and for facilitating healing. So I think in this phase, the most important piece is getting the entry level right. Where exactly do I start? And, I can think of particular when I treat shoulders, you'll see lots of people might come in and maybe the arm's been hanging down by the side, and they haven't been able to use it much in maybe a couple of months. And it's very painful if they've maybe got rotator cuff related pain or shoulder stiffness, for example. And it can be really transformative if we choose the right exercise, and suddenly the shoulders beginning to move more comfortably. And after doing the exercise, all of a sudden there's a lightness to the arm. It feels easier, and all of a sudden there's a step in the right direction, and there's a sense of, okay, I know what's going on, and now I'm starting to believe that I can actually get better. And so I think that entry level piece is really important, and there's a lot of nuance to it, Mike, I think. So
yeah, and I think if you get that right, though, it re-emphasizes your diagnosis.
Yeah.
So if you're telling the patient in front of you, I think the problem is this,
yeah,
and here's the first exercise I'm going to give you to fix it,
yeah,
and straight away they feel better.
Yeah.
Well, they're like, actually, Richard has probably got the right problem and the right solution here. So there's that buy-in, there's that belief.
Yeah.
And for you yourself, you're no longer thinking it could be something else.
Yeah.
And I think the second thing there is that puts recovery in the patient's hands.
Yeah.
And again, I have 2 people in this week with a fracture. And the hardest thing about that for the 2 of them is there's nothing they can do to make this better right now. They've got to offload that area. They've got to be nice. They've got to let that bone heal. They would love if I said, hop on the bike for 4 hours and your bone will improve. They would love to have that control, but they don't. They have to stay on their crutch, or they have to stay in their sling, or whatever it is. They have to let that tissue heal. Whereas if it is this musculoskeletal issue and they do exercise X and they feel way better, now it's like, okay, I'm actually in control here.